Welcome back. In this video we'll compare nephrotic to nephritic syndrome. Nephrotic syndrome is due to damage to the podocyte feet. These are small cells that prevent the filtration of proteins. So their function is to prevent proteins from leaving the blood into the urine. And of course, in nephrotic syndrome, because these cells are damaged, there will be great filtration of proteins. Anywhere more than 3.5 grams per day. So the proteins in the blood will decrease, including albumin, and they will increase in the urine, causing the frothy appearance. A very important protein that will also be filtered is the antithrombin 3. This protein normally prevents the coagulation and helps the blood thinning. And because it's filtered and wasted, there's a good chance of hypercoagulability. Another very important protein that will also be wasted is the immunoglobulins G. These are the most common default and natural antibodies, and so this predisposes the patient to infections. Nephrotic syndrome can be subdivided into different types depending on the cause of why podocytes would be damaged. The first subtype is the minimal change disease. This mainly affects children, and the only different thing that we see in these patients is the affected podocytes with nothing else. That's why it's called the minimal change disease. It is simply treated by steroids. The other type is the focal segmental glomerular sclerosis, and this type is very severe and progresses very quickly. The other type is the membranous nephropathy, and we also have amyloidosis and diabetic glomerular nephropathy. Now, unlike nephrotic syndrome, where we only have one type of cells that is damaged, in nephritic syndrome we have an inflammation involving the entire kidney. So all types of cells in the kidney will also be affected. Understandably, this will cause shedding of some cells of the kidneys itself into the urine, and will also be a lot of blood. So basically the kidney will lose the filtration process and filter most of the things that reach the kidney. So we will see proteins in the blood, we will see red blood cells, white blood cells, some tissues from the kidneys. But most of the filtration process that involves the actual harmful toxins will not be filtered. So nitrate in the blood will increase, potassium will also increase, the patient will have hypertension with increased renin, and of course GFR will decrease. So simply think that the kidney is failing and it is being physically damaged. So think of symptoms of renal failure with subnephrotic proteinuria. The subtypes we have are post-strep glomerulonephritis, Goodpasture syndrome, which is also known as pulmonary renal syndrome, immunoglobulin A nephropathy, which is very common, Alport syndrome, and membranoproliferative glomerulonephritis. So again, nephrotic syndrome is due to a change in one type of cell, and that will cause more filtration of only proteins, and nephritic syndrome is damage to the entire kidney with inflammation and damage to the kidney tissues. And of course, we'll have a lot of blood and a lot of other types of cells in the urine. And these are the subtypes of both diseases. It is very important to know the subtypes. I'll make another video explaining each of these subtypes individually, but that's probably for another day. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.